I am so tired of people not caring about Black women. How on earth can you say that Black women exaggerate pain?
Hey people, how you are doing today? It's your girl Destiny here, and welcome back to my channel. How you are doing? Hope you guys are doing great. So today's video is a very interesting video because it's all about Black women, and Black women are not here for it. So Dr. Jackie from the franchise Married to Medicine decided to come and speak on Black women and Black women's medical pain in terms of childbirth, and things that she was saying was not making sense, and this has gotten the outrage of Black women and the entire Black community. So apparently what happened is that Dr. Jackie from the franchise Married to Medicine, which I don't even watch that reality show anyway, but yeah, we know the reality show. If you don't, you can Google it. So it has to do with medical practitioner and their spouse and all that. So Dr. Jackie, she's a doctor, she's a gynecologist, and she was having an interview with one of our castmates. I think this interview happened 2020. This is a long time ago, but this interview has struck a bigger conversation now. So in this interview, a question was asked about why is it that the death rate of mothers during childbirth is high in the Black community. When it comes to Black women, the rate is high. Why? And Dr. Jackie went on to talk about how Black women used to exaggerate pain, how Black women used to cry wolf when it comes to pain and how they feel pain, and that has led to that. She went on to say a whole lot of things, which for me personally, I like having context, because they were saying that, oh, we're cutting a little bit of the clip and that we're just overreacting. But I need you guys to see this almost 2 minutes clip of her really explaining why the death rate of Black mothers are higher than other races.
Let's see, Dr. Jackie, you're keeping it moving, boo. I'm going to just keep it going, okay? Somebody asked why are Black females more likely to have problems with mortality with childbirth, Black females?
What was the question?
Black females, why more mortality rate with Black females?
Now, I wish we knew the answer, and I will not allow myself to say it is health disparity only. Same thing we're seeing with the CV, as you've told me, we have to say, is we as a race have more comorbidities. And what do we mean by that? Diabetes, hypertension, asthma, thyroid, the things that can compound already having that, and you turn around and get COVID, or you're pregnant, or CV, then you definitely are seeing African-American women with more maternity deaths. Care is important. Crazy enough, we still see patients come into the hospital that patient has not seen a doctor her entire pregnancy. Mm-hmm. And she comes in, fibroids. We're more likely to have hemorrhage in pregnancy or after delivery if you have fibroids. So it's so many things that go into that picture, and I don't want us to think it's just that doctors aren't taking care of Black women, because I can certainly say for the doctors in my practice and around me, we give everybody equal care. Now, I'm going to qualify this and be Dr. Heavenly for a minute. Sometimes as African American women, we're a bit more dramatic, and that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
Let me know what you think about what she said down in the comment section. Let me know what you think. If you agree with her, or if you think that, oh, we're just blowing this whole conversation out of proportion, it wasn't that deep, go down in the comment section and share your thought, because this conversation has gotten her called out. A lot of people are calling her out, which we're going to get to. But this is really interesting for me because there's a video I did about male gynecologists, and a lot of Black women were talking about how they rather see a Black female gynecologist. And this is a Black woman talking about how Black women cry wolf and how Black women needs to be serious. But one thing I want to pick out before I move on to the video is that she said a lot of Black women don't come to the hospital until it's time to delivery. The same high saying in the same breath saying that, oh, Black women come to the hospital 25 times even before birth. So which one? Anyway, I personally have a lot to say, but this video has gotten her called out on social media. A lot of people are speaking up, and she decided to make an apology video to apologize to black women, and this is what she has to say. Let's watch this.
That I made during a 2020 live interview with one of my castmates. First and most importantly, to black women and mothers, including your friends, families, and the medical community who cares for you. Because my words left you hurt and feeling unsupported, I want you to know I hear you, I see you, I believe you, and I apologize from the bottom of my heart. I am brokenhearted over this. The guilt and reality that I have hurt and offended people, especially black women, and some of my own patients, pains me to my core. As I look back over the 2-hour video again and again, I admit that I used the wrong words and descriptions to properly convey my concerns regarding maternal mortality related to women of color. But the fact is, we must do more because we are still dying more. If I could say it all over again, here's how I'd say it. When experiencing a health matter, keep a log of your concerns and symptoms so that you can provide them accurately to your physician. Have a buddy system, someone who can advocate for you when you're with a physician, especially when pregnant. Know that a second and third opinion is not just sometimes warranted, but necessary. I thank you for taking out time from your holiday to tune into my apology and my self-dedication to black women and healthcare. I've been shaken and moved to be better. Happy holidays to you and yours. I'm taking a much-needed pause to address comments that...
So that was our apology. Please go down in the comment section and share your thoughts. Let me know what you think about the initial video, what she said, and then what she came back to say in our apology video. Go down in the comment section and share your thoughts, but please keep it respectful. For me, I find that really interesting. She talking about, oh, what she's saying, that, oh, keep a log, and somebody... Do other races do that? Do they tell a white woman to keep a log, to have somebody to advocate for them during pregnancy? Do they do that? Do they ask them to do that? So for me, I really find this conversation, especially coming from a black doctor, from a black gynecologist, I really find this very, very interesting. And this has gotten a lot of people, especially black women, to speak up and talk and give their opinion on what they think about the entire situation. Anyway, guys, let's go check out what they have to say. Then we'll come back and talk.
I will never pass up the opportunity to talk about women's health because it is so important to me. There is a video circulating right now of the Married to Medicine Dr. Jackie stating that in particular black women need to stop acting dramatic when it comes to their pain and their symptoms. And y'all, that just triggered me, because why do black women always get called as being dramatic when we're talking about what our bodies are going through? Nothing's dramatic about it, and this is real life, and I need people to start taking us seriously. Okay, when I was about 14 years old, when I first got diagnosed with endometriosis, I think I probably already had like 2 or 3 surgeries. And I started seeing this new doctor. He was a male gynecologist. And I was telling him, hey, look, I'm still in pain 10 out of 10 every day. I can barely eat. I'm throwing up. I'm in and out of the emergency room. And he literally said, if you've had this many surgeries, it's impossible for you to be in this much pain. Like, I'm sorry, but like, I don't believe you. And I had to go months and more agonizing pain before I had surgery. And for him to stop in the middle of my surgery and come out and apologize to my parents for saying, I'm so sorry, I should have believed her. But why didn't you believe me from the beginning? Exactly. When I came in and told you this is what I was going through, you thought I was joking. And it's really just so sad that a lot of women have to go through pain for months and months and months and months for somebody to believe them, or if they even do believe us. Yeah. It's really sad, and as a whole we need to do better. And for that to have came out of a black woman's mouth, I'm disappointed.
Sometimes as African-American women, we're a bit more dramatic.
This is why when my fellow black sisters were pushing the narrative that in order to have good medical care, we needed to go to black doctors, I quietly shook my head to myself and said, that's not always true. You see, I've been on both sides of this. I'm a nurse who has worked in a postpartum unit, and I've also been a patient who's given birth to 2 babies in a hospital. I can tell you from experience that good doctors and nurses come in all shapes, sizes, and colors. And unfortunately, a black doctor does not guarantee a good, safe experience. As women of color, we need to concern ourselves just as much with the quality of the provider. And as a mother, you get to choose the practice that you deliver with. So do your research. Look up their reviews, their outcomes, and if there are any pending lawsuits for negligence. And if you have a bad feeling about a doctor you've already started with, you can always move on to another practice. A white woman delivered my babies, and I wouldn't change anything because she listened to my concerns, she knew what she was doing, and she made sure my babies came safely into the world. As far as I'm concerned, that's my only requirements.
What Dr. Jackie said about black women made me sick to my stomach. And I wasn't going to touch on it because I said I felt like it was something that black women needed to really lead the conversation. But there's something missing in this because what Jackie said was master shit. And I'm going to explain to you how. It was Dr. James Marion Sims who invented gynecology in the 1800s. Okay, when he invented gynecology, he also invented this idea that black women do not feel pain. And within his practice, what he would do is he would perform surgery on the women, the slaves that he owned, while they were awake. He would sometimes take these women's babies and crack their open to examine the baby's brain. And also what he would do, you have to remember, they were slaves. How did they conceive children? Through correct. And so let's fast forward to today. A black doctor is using the same rhetoric that a master used towards people who she probably was ancestrally related to. She's using that same rhetoric today in 2023. The same rhetoric invented in the 1800s, she's using today in 2023 to describe you. Because he too would have called you a drama queen when you went to your doctor and complained. He too would have called you a drama queen when you said you were in pain and you needed help. Instead of her using her platform, her blackness and her womanhood to advocate for you to be listened to be heard, to advocate for when you speak up that whatever you're feeling is acknowledged and investigated, she's calling you extra. She's calling you a liar. I take issue with that. And when she was giving the chance to apologize or to redact her lies because this is untruthful, she did what a master would do. She blamed you and said you took something out of context. She blamed you and said you were the problem. You didn't fully listen. No, we heard everything and we heard an error. So you know what? Let's take you out of the context of that show. You got to go. Because if this is the type of narrative that you're spewing, our big red flag was how you treated Buffy. But for some reason you were given grace. But now this is the final straw. You got to go. You got to go because things like this end lives. Things like this cause error, not just to the mother, but to the child. It's massive. And y'all got to get that off you because it's like shackles.
Danielle just sent me the information about the Dr. Jackie situation. And even though she apologized, it still pissed me off. Oh, black women go to the doctor and complain, and they're exaggerating about their pain. And in turn, you're saying that black women's pain during pregnancy should not be taken seriously. Danielle had preeclampsia during her pregnancy. She had high blood pressure. She threw up if she drank a glass of water, no cap. The first two doctors that we went through during her pregnancy were black. She went to them and told them that she kept throwing up and she was in pain, and they didn't take her seriously. Oh, it's normal. You'll be okay. Yeah, it's normal in the first trimester, but once you get past it, it should stop. It didn't stop. So we changed her doctor for the third time, and it was a white man. He not only took her pain and concern serious, but he actually ordered a series of tests to be done that found out that she had hyperemesis, whatever it is, and preeclampsia, which in turn she had to be induced almost a month before our son got here. And that wasn't no walk in the park. I don't know if all of y'all are reading from the same book of stupid that's telling y'all not to take a black woman's pain during pregnancy serious. But when we got to the hospital, we also had 3 black nurses that was helping her get induced. She was being induced for 3 days straight, and they kept telling her, oh, you're fine. Your body can take it. Now, of course, I was angry with the doctor that you just had us dealing with nurses. He wasn't on the scene when we first got to the hospital. But it was during baby making season, so the brother was busy. He got to the hospital to check on Danielle on the 3rd day, and it turns out that he had to do an emergency C-section because the baby was stuck. Then come to find out, her uterus almost ruptured while being induced. Ooh. And all of the nurses, even the registered nurses that were around, acted clueless. So excuse me for being a little PO'd that this doctor, who is a black woman, think that black women are exaggerating about their pain during pregnancy. Because for every one person that thinks like that, there's 1,000 other people who also think like that. And I'm telling you to please stop it. Kept throwing up, and she was in pain, and they didn't take her serious.
So he's talking about his wife who had preeclampsia with her pregnancy, who saw several doctors that looked like us who ignored her preeclampsia symptoms. I encourage you to go back and watch this video. But I want to talk about here is the issue that a lot of us face when we do have doctors that look like us. We all know the Dr. Jackie thing that's trending, but I too had the same issue with my last pregnancy at 42 years old. My husband, because of the issues that I've had with preeclampsia in the past, my husband sought out a female doctor for me. And we were so happy. He was so excited because that's very rare. You know, we were living in South Florida, and long story short, this doctor was the meanest, cruelest doctor that I have ever had as an OBGYN. She quickly looked at my history and came in the room yelling at me, saying, why would you get pregnant with your history? You know, are you trying to have a stroke? Who's going to raise your kids if you die? It was instant fear. And I replied to her, you know, if something happens to me, their father will take care of them, who is also my husband. And after that, she left me on the table, naked, exposed, with the door wide open. I ran to my car in tears. So I do believe we need to talk about the issues that doctors who look like us, how they are in this system. And sometimes they're the biggest perpetrators of the things that are done against us. I also had an issue when the baby was in the NICU, where I had some issues with some of the white nurses, and it was a unit manager who looked like me who took up for those white nurses before she took up for me and did nothing to help me. So, you know, everybody knows that, you know, I am pro-black. I talk a lot about black history, but we got to let the truth be told about doctors and nurses who are in the system that need to educate themselves to better help the people that look like them who they serve.
Mm-hmm. I see you, I believe you, and I apologize from the bottom of my heart.
So are we just going to do away with Grace? I understand that her words may have hurt some, and I definitely don't condone anything that she said. However, do we just do away with Grace when it comes to black people? So she apologized, and now we should give her an opportunity to show and prove. Why everybody's just trying to automatically cancel her? You still go and see that white doctor who ain't believed you the first 2 kids you had, and now you on your 3rd. Come on now.
I am so tired of people not caring about black women. How on earth can you say that black women exaggerate pain and then go and talk to the VP about how black women are 3 times more likely to die from childbirth? Aren't those two correlated? I had complications at childbirth, which I admit I still have some PTSD from, but to hear a black OBGYN say this in public, like how on earth are you going to tell someone they don't feel what they feel? And as someone who, number one, has never given birth. And then number two, as someone who is responsible for the well-being and care of primarily Black women, and you say that out loud and then you stand 10 toes down on Twitter, there are wolves in sheep's clothing everywhere. And for those of y'all who are asking Dr. Jackie to apologize, stop asking for that. She said what she said. She meant what she said. It is more dangerous for us to continue to put ourselves in situations and around people who do not advocate for us. We need to know who these people are so that we can remove ourselves and go get second and third and fourth opinion instead of trusting someone who in private could care less about us. I'm happy we finally know what Dr. Jackie really thinks of us. I'm just shocked that the wool has been pulled over our eyes yet again.
A bit more dramatic, and that you go to the doctor and you complain.
This is so disheartening to hear this. How you pass down this bias against African American women, and you're a doctor that look like us, and you don't even believe us? What is it going to take? My mother is not here because the doctor didn't believe her. She complained and complained, and the doctor said, oh, you're fine, you're just getting older. She passed out, went to another hospital, went to the emergency room. They said she had stage 4 cancer, gave her days to live. My niece went to her doctor. I'm 8 months pregnant. Please help me. Oh, you're fine. Go home, put your feet up. She go to the emergency room, finding her blood pressure was so elevated that they had to take the baby that night. So how many people do we have to talk about? Oh, my God, Dr. Jackie, how can you do this? How can you say that? Oh, we need to have some conversations. You can't pass this down. You can't continue this rhetoric. Oh, my God.
This is for entertainment purposes only, and I am covered by the Fair Use Act to utilize this video for educational purpose. TikTok. I want to first say thank y'all for speaking up. Firstly, I want to thank the women that took the time out to record their videos and share with us their personal experiences with Dr. J. I know firsthand how you expect your pregnancy to go, and then there's some issues along the way that you weren't prepared for. You may have read every book and article to prepare, only to find out you had preeclampsia, only to find out you have to have an emergency C-section, only to find out that you have to have that baby natural because you went in too late to get the epidural. I hadn't had the C-section, but I had all 2 of what I just named. So thank you. I just watched Dr. Jackie's response, her official response. And I knew the moment she started that she had been crying. I could tell in her eyes. How am I feeling about it? I'm moved. I have a heart. I'm not cold-hearted. I'm moved because at the end of the day, we don't expect you to be perfect, Dr. Jackie. I think you expect you to be perfect. You put that expectation on yourself, and probably your career is like very demanding, so you can't make those mistakes. I get it. That first apology was rubbing me all kinds of ways, but right. But this is what we wanted in the beginning. How y'all feeling?
I do not accept Dr. Jackie's apology. If y'all want to accept it, that's on y'all, but I see through all them crocodile tears. The only reason why she's apologizing is because she's been getting backlash for the last couple of days. You issued an initial statement on Thursday only to turn around and spin the block, and now you're backpedaling, saying something completely different from what you said initially. This was your initial statement, and as you can see, it's not an apology in sight. You're backpedaling, Dr. Jackie, and the only reason you're doing it is because your brand is in jeopardy. I do not accept her apology, and as far as I'm concerned, if you're not a Black woman or a Black mother, it's really none of your business. It's really not your place to tell us whether or not we should accept it or how we should move on from the situation. What Dr. Jackie said was completely unacceptable, and it shouldn't have taken her 5 days to recognize that. It's not the first time that she's made harmful statements against Black women, and it will not be the last. It's going to take more than a couple days and some crocodile tears for her to unlearn her internalized anti-Blackness. But anyways, I made an entire YouTube video talking about the situation. Click the link in my bio. Support Black women, support Black content creators. Enjoy your holiday, and I'll be back for some more, y'all.
I am so disappointed at what Dr. Jackie said, but unfortunately, I am not surprised. I'm not a mother and I don't have any kids, but if you're a Black woman, 9 times out of 10, you or someone that you know has gone through some type of traumatic experience due to a medical doctor not taking your concerns or your pain seriously. Black women's mortality rate when it comes to childbirth is scary. Like, it's something that actually deters me from wanting to give birth. And it's even more devastating that so many Black women seek out Black female doctors thinking that they'll be more safe, their feelings will be heard, they'll be more validated, they'll have more options when it comes to how they want to give birth. But in some cases, when they pick Dr. Jackie, they don't find out until they're about to have their baby that she is no different than any of the white male doctors in the hospital. And actually, I'll argue that she could be worse. All the isms are bad, but when you find somebody that has an internalized ism, in Dr. Jackie's case, internalized racism, be afraid. Be very afraid, because she most likely subscribes to the very anti-Black practices and rhetoric that she has probably heard going through medical school and in certain medical spaces. And for those of you who don't know, not taking Black women's pain seriously is literally a concept that dates back to slavery times, antebellum times. They literally do not believe that Black women can experience pain. They don't. Just the idea that Black women can experience pain or are stronger than other races is dehumanizing. Like, do y'all not understand that? I don't watch Married to Medicine, but I did see the clip of Dr. Jackie putting Buffy's fertility struggles on blast in a room full of people. And that's all I needed to know. That's all I needed to see, honestly.
But I think that Dr. Jackie does not have the capacity to understand why and how what she said is harmful. I still don't get that, because when she goes into talking about what she should have said, it doesn't answer the question. The question was why? Why does Black women experience such a disproportionately high maternal mortality rate? That was the question. And what she offered was a solution to Black women. And what I'm finding is an unwillingness to call her peers in and ask her peers to do any work. The reality of it is a lot of Black women, myself included, are terrified to go and seek out medical care for fear that we won't be heard, we won't be seen, our pain will be ignored, we will be told that we're putting on or making up. Everything that Dr. Jackie said in her original video that got all this controversy started are a lot of the real fears that Black women have about going to the doctor. This idea that a woman at the most vulnerable time in her life, carrying a child, when her body is producing life for another human being, cannot come to you and ask for time off from work without you thinking that she's crying wolf. These are, like, Dr. Jackie needs to directly address the things that she said. And she needs to recognize that that way of thinking is the problem. It is the reason why maternal mortality rate is so high for Black women. Because so many doctors do not believe Black women. They believe the narrative that Black women are crying wolf. They believe that Black women do not experience pain the way that other women do. Until Dr. Jackie is ready to call her medical peers in and have a real conversation about her own anti-Blackness and how that shows up in her practice and how anti-Blackness shows up in other doctors that she works with, Dr. Jackie is not prepared to take on the role of advocacy for Black women and our maternal mortality rates. I accept her apology, but she needs to be removed from the position, and I would still encourage Black women to be very cautious about seeing Dr. Jackie, because Dr. Jackie does not see Black women. She does not. And this is the thing too. This is not the only misstep of Dr. Jackie's. I have gone back and watched other clips and seen other instances of her being intentionally malicious and harmful to Black women, even surrounding their fertility. This woman, I hear the apology. I receive it. You sorry. I believe that. But do I believe that the correction that needs to happen has occurred? Absolutely not. What I would encourage Dr. Jackie to do is to she needs to have a sit down with Black women. And I would encourage her to have that sit down with Black women who are in fact on Medicaid. And she needs to pay them and compensate them for their time, for the education that she needs to receive in that session. She needs a session with Black women. She needs to understand why especially poor Black women are terrified to seek out medical care. And she should fully understand the history of exploitation and experimentation on Black women when it comes to our health and medical treatment. Like, this is unacceptable. I'm sorry. I can't. I want to accept the apology. And again, but she still should not be advocating for Black women. She's not the voice.
Please go down in the comment section and share your thoughts. Love to know what you think about this conversation down in the comment section. Do you think, oh, Dr. Jackie was actually very, very sorry? Do you accept apology? What do you think about the entire situation about people not believing black women when they show concern and say they are in pain, and concern when it comes to healthcare, when people don't take the doctors and nurses don't take them serious? Please go down in the comment section and share your thought, but please keep it respectful. Here on this channel, we're allowed to disagree, but we do it in a respectful way. So please, let's be respectful as always. So here's my own thought. A couple of weeks ago, I think about 2 weeks ago, I posted a video about nurses, how nurses, some people like the aesthetic nurses, and why nurses are no longer practicing nurses again. And for me, not even hearing this, just like, okay. So I feel like this old narrative of black women not feeling pain, I feel like it's almost like a nationwide thing, not even just in America. Because even here in Nigeria, that's mostly like black women and black doctors and everything. You still get to see people telling women that can't even... I have a friend, a childhood friend that passed on from childbirth. And that's because she wasn't being listened. Because when you say, I'm feeling pain, they tell you can do it. I can't do it, they tell you can do it. And there's this thing they do here in Nigeria. If you're in Nigeria, you know this thing. If you've ever given birth in Nigeria, you know this thing. That when you're saying something, especially when you're in labor and you're in the hospital and you're shouting, they tell you to shut your mouth. And they're telling you to hush. Then tell you that, why are you shouting? Why are you shouting? They start talking, the body doctor, the nurse, some doctors, some nurses start talking to you rudely. And this is you crying and shouting during labor pain without no painkiller, no epidural, nothing. They'll tell you that, why are you shouting? Is it not to give birth? Like, and that's because I really feel like maybe in medical school, I'm not a medical doctor, a medical practitioner. Maybe in medical school, they actually tell them that the threshold pain for black women is different. Like, we're super women, nothing happens to them. And it's really sad that this is coming from a black woman. It's really sad. But getting to know that even Dr. Jackie does not even have kids, but even at that, you should even know the struggle of always ignoring black women, and black women are not taken serious. And that should even show that you should even come from a place of compassion for a woman that looks exactly like you. But you're trying to tell the world and even justify the other doctors that are not black doctors that choose to not pay attention to black women and not take black women serious. For you to even justify it for saying this publicly, that means in your head, in your mind, you really think that, yes, black women cry wolf. It's really sad. And that's why even here in Nigeria, that's one thing I always have that conversation. I'm not even going to trade my health for anything else. Like, I rather pay more and get the care that I need rather than, no, I will not do it to myself. Because I've seen it. I have seen it even here in Nigeria, even here in the continent. Black women, you see them, they shame black women that want CS, that can go through vaginal birth. They shame black women that decide to take epidural and decide for the pain killing and all that. They shame black women, yeah, in Nigeria. When you say, oh no, I can't take the pain, I need the help with, they shame you for not going through those pain by yourself and doing it naturally. They'll tell you, do it naturally, you're a Hebrew woman. It's really sad. It's really sad to know that a black woman really thinks this about black women and is really pushing out the narrative. And do I think that she's actually sorry? No. I don't think she's sorry. Anyway, guys, this video, there's going to be a part 2 because some women has come out to speak up on Dr. Jackie, to share their story on Dr. Jackie and their experience going to Dr. Jackie, how they were treated. And I find that really interesting. So that video is going to be next. So go check out that video so you hear black women coming to share their story and sharing their experience with Dr. Jackie, because people are saying that they should forgive her for her apology, but it's really nice to hear from firsthand for women that has actually experienced her firsthand. Anyway, guys, please go down in the comment section and share your thoughts. Love to know what you think about this conversation down in the comment section, but please keep it respectful, okay? With that all said, go on and share this video with somebody that you want to be part of the conversation, because that's what we do here. We have banging conversation. So go on and share this video. Please don't forget to give this video a thumbs up, smash the like button, because this helps YouTube to push out my content for more people to see, and that will be you supporting your Girl, with that all said, guys, subscribe if you haven't subscribed, and I'll see you guys in my next video. Deuces.